Thanks, Ben. Hi, everyone. My name is Kristen St. John. I'm the Deputy Director of National Grassroots. First of all, thank you for being here. Ben, thanks so much for inviting me to come on. I'm very excited. I'm going to be talking about National Health Center Week, which is starting August 8th. And next, please. So we're just going to do a quick one. So the goals for National Health Center Week is to celebrate health centers as well as increase awareness. A lot of folks don't realize that this one particular health center that they may even go to or is on the corner of their main street is a community health center, FQHC. And also to, as you're pumping up the information about them, also advocating for sustainable funding and policies for community health centers. Next. So this particular year, I'm very excited. The theme is National Health Community Health Centers, the chemistry for strong communities. As you can tell, it is our version of a periodic table, which if you, next slide, is basically what we're going to do is each day is going to be broken down and have their own graphics and also pulls in from the periodic table to explain, like as you see on that Friday is staff appreciation, and then you also have healthcare for the homeless that I believe is Tuesday off the top of my head, and so we pull in all the different elements to and what's important that makes community health centers who they are. Next. So as I said before, we have focus days, and each day throughout the whole week, we'll be focusing on social determinants of health. We're also doing a special look on the PACE program and dealing with isolationism, especially with seniors. That they have gone through this past year and some change because of COVID. I have an 80-year-old mother. She would shoot me if she heard me say her age publicly, but she lives alone in Los Angeles, and you know she was going through it as well. So we're definitely going to be promoting that program as well. And what's really cool with these focus days is that each will have at least one, if not more, blogs that go to that day, as well as graphics and information. And from what's really cool with the blogs that I've been trying to do, this is going to be my third health center week with you all, is we try to not only promote health centers in general, but through the blogs, we're reaching out and we're hearing from folks at, you know, organizations like, you know, healthcare for the homeless and Sesame Street in the communities and the National Center for Health and Public Housing, but as well as, you know, community health centers like Duffy Health Center in Hyannis, Massachusetts, and Access Community Health Network in Chicago, telling their stories. And through there, we're going to be posting it on social media, tagging the various health centers, and you know, I'm hoping you get a chance to actually read the blogs and then, you know, go ahead and also promote and share on social media. Next. So what's really cool is obviously we have a hashtag NHCW 2021, as well as we're encouraging people to use hashtag value CHCs and hashtag FQHCs. And previously, the past 2 years, we've had an average of 15 to 20 million impressions on social media, which is mind-blowing. Only issue is that a lot of the stuff that's on social media, you know, we all see it. We're a very active community, but trying to figure out ways to kind of break out of the bubble. We are encouraging people when they do post stuff on social media in regards, I mean, just as general in regards to community health centers, but especially about this week, as they're sharing all the information that we're going to be putting out there, is to tag elected officials, and also to make sure to either tag or give me a heads up for the HC advocacy on Twitter or Facebook, so we can also help by, you know, retweeting your stuff and quoting your things. Next slide, please. Also, we have an online store. So if you're into the swag and like to have some fun, definitely go and check it out. I am a mug kid, so I've already ordered my mugs from the store, and everything is really cool, and to help promote it. And as people walk into your health center, or even when you're having staff appreciation during that week and everyone's partying, kind of giving them a little something. And then final slide. And I'd also like to just thank our sponsors, Athena Health, Satine Corporation, McKesson, BKD, United Healthcare, Pfizer, NextGen, eClinicalWorks. If it wasn't for these sponsors, we couldn't do half of what we're planning on doing and getting the community all set and celebrating who we are and our uniqueness. And especially 50 years in, I think we deserve that extra piece of cake and extra cup of coffee with a little something in it just to celebrate. So I just want to say thank you to everyone for giving me the time to share, and I hope to see you all celebrating with us. And if anyone has any questions, I can actually put in the chat. I can put the website in, as well as my my email address, how you can get a hold of me, and I can answer any questions. Thank you. Appreciate it. Back to you, Ben.
Thank you so much, Kristen. So the impacts of climate change have dominated the news in recent days. One of the things that we've seen just this summer are massive record-setting temperatures, over 118 degrees in the Pacific Northwest. They're responsible for numerous deaths. We've seen massive wildfires in the West, with smoke experienced on the East Coast. We've seen extreme drought conditions across half the United States, extreme rain and flooding events in Utah, Colorado, and the Northeast. In Germany and Belgium, once in a 1,000-year rain and flooding. Seeing triple-digit temperatures in Canada and Siberia. Climate change has hit a crisis point, and it's impacting low wealth people of color disproportionately, even though they've contributed the least to its cause. Health centers are on the front lines of serving the victims of pollution and climate change, from refugees of conflict in Central and South America that's been fueled by climate change, to agricultural workers and homeless suffering from heat-related illnesses, and patients experiencing the effects of toxic waste and pollution. Section 330 of the Public Health Service Act, subsection B2, authorizes health centers to provide additional services necessary for the adequate support of primary health services, including environmental health services, and including the detection and alleviation of unhealthful conditions associated with water supplies, chemical and pesticide exposure, and air quality. The aim of this webinar is to provide health centers, health center controlled networks, and primary care associations the opportunity to hear directly from health center leaders working in their communities to address pressing environmental concerns. Our discussions today will focus on health centers and PCAs on the front lines of the environmental health and climate crisis. With that, I'm extremely grateful to introduce our next guest, Michael Regan, the EPA Administrator, who will be providing us with opening remarks for today's discussion. I had the pleasure of serving with Mr. Regan in North Carolina under Governor Roy Cooper's administration in my prior role as Deputy Secretary of Health. On March 11, 2021, Michael Regan was sworn in as the 16th Administrator of the Environmental Protection Agency and is the first Black man and second person of color to lead the US EPA. Administrator Regan, let me turn it over to you.
Hello, everyone. It's great to be here to help kick off the National Association of Community Health Centers webinar. I want to thank you for the exemplary work you do to build stronger and healthier communities across our nation. During a recent trip to Milwaukee, I had the opportunity to visit a community health center and to see this work in action. You're making a tremendous difference in people's lives and providing essential services to those who need them the most. At EPA, we know that protecting public health and protecting the environment go hand in hand. That's why we're laser focused on reducing greenhouse gas pollution that causes climate change and tackling other kinds of pollution that contribute to asthma, heart disease, and other ailments. In all that we do, we're keeping environmental justice front of mind. COVID-19 magnified the health disparities facing our communities of color, the same communities who suffer disproportionately from the impacts of climate change, who face higher rates of heart and lung disease, and whose children are more likely to develop asthma. We will not allow these disparities to persist any longer. At EPA, we will live and breathe this mission and embed environmental justice into our DNA. Thank you again for inviting me to join you. Together, we will ensure that all people, regardless of the color of their skin, the money in their pocket, or their zip code, can live full and healthy lives.
Thank you so much, Administrator Regan. It is my pleasure now to turn to our incredible panel of guests for today's discussion. First, Dr. Darielys Cordero-Rosario is the Director of Special Programs and Quality Improvement at Asociación de Salud Primaria de Puerto Rico, Incorporated in San Juan, Puerto Rico. Next is Ms. Gerrelda Davis. She is the Executive Director of the Louisiana Primary Care Association in Baton Rouge, Louisiana. Next also is Mr. Clarence Pierce, who is the CEO of Hamilton Community Health Network in Flint, Michigan. And our final guest is Ms. Chauncia Willis. She is the co-founder and CEO of the Institute for Diversity and Inclusion in Emergency Management in College Park, Georgia. Thank you all for being here today. So let's jump right in. Starting with you, Gerrelda. Low-income and racially marginalized populations are disproportionately impacted by pollution and the impacts of climate change. Have you seen this manifested in your service areas?
And thank you. So according to the United Nations, Cancer Alley in Louisiana was originally dubbed Plantation Country and is located in Louisiana along the lower Mississippi River, where enslaved Africans were forced to labor. Today, it serves as an industrial hub with nearly 150 oil refineries, plastic plants, and chemical facilities. What we know is that it is all about industry versus environment. For example, in St. John Parish, which is 58% African American, it has the worst emissions in the world, but there are plenty of refinery jobs which pay good wages. Yes, environmental racism is blatant and undeniable in Cancer Alley. The question to ask is, what is the cost of a community's health to move the community to middle class? Jobs are brought to an area at what cost? In 2003, Berry surveyed 11 plants in St. James Parish, which are 49% African American, and researchers found that these plants only employed between 4.9% and 19.4% African Americans, which is remarkably low in comparison to the overall population. Consequently, although the jobs are plentiful, the people that are most impacted by the environment are those not getting an advantage economically. We know that there are two sides to the issue: petrochemical and water treatment. There is data that speaks volumes: cancer rates, respiratory illnesses, prevalence of stress and depression. The list goes on and on. However, there are those who still deny that these issues exist and are caused by the environmental crimes. Kimberly Terrell and Wesley James stated in, and this is very important, in Environmental Justice magazine, that with two exceptions, every parish in Louisiana had reported at least one COVID-19 related death by July 17, 2020. 6 of those 10 parishes with the highest COVID death rates were in Louisiana through July 17, 2020, were in Cancer Alley. St. John the Baptist, St. James, Orleans, Iberville, West Baton Rouge, and Jefferson. Among those parishes, COVID-19 death rates were 2.1 to 3.7 fold above the state median. Contrast, only 4 of the 53 parishes outside of Cancer Alley were in this top 10 group, 2 of which were adjacent to Cancer Alley parishes. Across all our parishes, increased per capita COVID deaths rates were associated with higher respiratory hazard and immunological hazard. And we also know that higher death rates also were associated with higher percentage of Black residents, greater population density, and more days since the first reported COVID-19 case among parishes. No other factors were significantly associated with per capita COVID-19 deaths among parishes, including the prevalence, which we heard in the beginning, of diabetes and poverty. And lastly, then there are a number of hurricanes and natural disasters Louisiana experiences each year. For example, not only was Louisiana on the front lines during the COVID pandemic in 2020, but in Louisiana, unfortunately, we had the pleasure of 5 named storms hitting, including Hurricane Laura, which made landfall August 27th near Cameron, Louisiana, with sustained winds of 150 miles per hour, making it the strongest hurricane in terms of wind speed to make landfall in Louisiana since 1856. So we know that climate change is definitely, and we are impacted by pollution in Louisiana and our marginalized populations where our health centers are located.
Gerrelda, your example in Louisiana really points to the fact that the people at health centers serve are disproportionately impacted and really reaping none of the benefits of the industry in the area. That small percentage of employment sounds like people from outside of those parishes are getting the jobs, but the people that are getting the impact of pollution are the very same people that your health centers serve with no net benefit from it.
Exactly.
Thank you for sharing that. Clarence, let's move on to you. How were you first alerted to the environmental issue in your area, now known as the Flint water crisis? What were the signs in your clinical data that suggested an environmental problem?
Well, thank you, Ben. It's good to be with you this afternoon. And I know mostly everyone has heard about the Flint water crisis and the impact it's had on our community. But back in 2014, our patients here at Hamilton were severely impacted by having lead leach into the water system. This was a man-made problem, and it was created by an emergency manager that was installed by our governor. Flint is, at the time, unfortunately, was in receivership, which means we were essentially bankrupt at the time. And of course, having a low income population, medically underserved, the state took control of the city and basically made all decisions as it related to the city and the things we do here in Flint. The emergency manager made a decision to change the water source from a fresh water system to a river water system. That created a lot of problems that no one apparently could see at the time. River water is much harder and much more difficult to clean up than a freshwater system. And even when our patients' population expressed concerns about the water, and there were many concerns at the time and many complaints, they were all ignored by our leaders. And unfortunately, by them ignoring the situation, it resulted in our drinking water being filled with lead. Now, there were signs, and we at first, along with the health department and along with all the other health-related organizations, really didn't understand what was going on because this was something new and it was man-made. We had no idea what was going on. We did see some signs in some of our patient population, but we thought it was your typical, paint chips that kids may pick up and eat. And we didn't think it was widespread until we heard through a report that one of our residents here in Flint was complaining about the city. She was complaining to the city about her water. And that prompted us to look a little bit closer. And so when we heard from Dr. Mona Atisha, who is a pediatrician here in Flint, she had been doing some preliminary investigation and study with her patient population. And she found that the lead levels were extremely high in the kids. She had been complaining to the state officials, was not getting anywhere. They did not want to listen. Everyone kept ignoring the situation and said that the water was fine and it was nothing to worry about. However, when Dr. Mona Atisha actually advised one of the local organizations here, the Greater Flint Health Coalition, and I'm a board member on that organization, along with a lot of other local leaders, hospitals, and other agencies. When we heard about it from her, we held a press conference. And in the press conference, Dr. Mona Atisha presented the information she had retrieved from the study. And it became quite evident that we had a major problem and no one was aware of how bad it was. But at that point, that's when we all started to join hands, so to speak, and identify the things we needed to do to try to get ahead of this problem.
And Clarence, that's a great example of how community coalitions can really bring agency to, voiceless members that have been directly impacted by neglect, by really, what Administrator Regan coined environmental injustice, which is what you all experience.
Yes.
Let's open up this question for a few of you. With environmental degradation and climate change reaching a tipping point, we're seeing it all over. What should health centers be doing to protect their communities? Darielys, let's start with you.
Thank you. Yes, well, from our previous experience with a powerful disaster as Hurricane Maria in 2017, and looking forward, taking in consideration all this discussion and conversation related to the impact of climate change on rising temperatures and therefore the potential to continue to experience more powerful hurricanes in the Caribbean. So I think that to protect their communities, health centers should focus on two things. Number one is infrastructure resilience, and the other thing is warfare preparedness. I think that those two areas are key for the community health center continue operations, but also during an emergency and after the disaster hit, how they will continue addressing the mission of access to healthcare and addressing other social needs of the community. So thinking about infrastructure resilience, I will highlight three things. Number one, related to utilities, thinking about energy backup and water storage systems. For community health centers, it's extremely important to have a plan A and a plan B related to energy power supply. In the case of our community health centers in Puerto Rico, at this point, all of them have get high capacity generators, at least one high capacity generators. And they are also on the way to install solar panels in all of the clinics around the island. Also, it's very important to improve the water capacity of the storage, the capacity of the storage system for water, because when you have lost the energy for several days, this directly will impact the water supply on your facility. And this is important because on the social part of the equation, when patients and most vulnerable patients experience a loss on energy, if a community health center have several energy backups, those asthmatic patients can go to a clinic, connect their machines. Those dialysis patients that make their procedures at home can go to the community health center and continue the process. So there could be a continuation of the primary care services of the patient. Another thing to consider is in terms of refrigerators and freezers. In order to protect the vaccines and medications, for example, insulin for diabetic patients, vaccine has is right now under COVID pandemic. So the idea is to have freezer and refrigerators that can be connected to a solar power system. But if not, it's important to have those sensors that can detect a change in temperature that can detect if the vaccines or the medications could be in danger. For example, after Hurricane Maria, right now in Puerto Rico, over 60% of our FQACs, of our community health centers, has those refrigerators with sensor time sensitive, energy sensitive, I'm sorry. And some of them are also connected to the solar panels to have backup of the backup. Another area is the communication systems. In Puerto Rico, after Hurricane Maria hit, the island get completely incommunicated health centers between the clinic, health centers with the Puerto Rico Department of Health, with the, communication was a complete disaster. So it's a main area to develop right now. And through the PCA, we are working with them designing an integrated communication network. And again, it's to have a redundancy. It's to not be dependent on cell phones, on internet. But if all of that disappear, what next? So this is a communication network using high frequency radios. Another area is geographical access. We need to think how we are gonna outreach to the community, to those more remote places and communities in the island. So we need to get other mobile units that can bring you more access to those communities. And those has been another resilience on the infrastructure that our organization have been working on, and all of the health centers have a mobile unit to continue delivering their services and work. And talking about warfare preparedness, I think that two things are very, very important. Number one is that the health center should clearly identify which are those social and environmental vulnerabilities of the communities that they serve. And those environmental and social vulnerabilities needs to be part of the vulnerability risk assessment and thereby included in the emergency preparedness plans, or how I will be addressing those vulnerabilities during a disaster. And in terms of the workforce also, it's extremely important to define who will be taking which role during the emergency, and that needs to be done prior to the emergency come. So the emergency plan should be very familiar to the key staff, and everyone should know which will be my responsibility during the emergency. So I think that those are areas very key to consider, because natural disaster, can impact your facility for days or weeks, but it could be impacting your facility for months, as was the case in Puerto Rico.
Yeah, and thank you for that, because one of the things that the health centers in Puerto Rico needed to do was really step in when a lot of the other public agencies weren't delivering, when the federal government, was slow in its response, when you had to address issues around the basic essentials of electricity and communication. And just like in Flint, Michigan, water. I mean, it doesn't get more essential than water. And so, health centers are stepping in places where we haven't had to before, simply because the established systems that are in place are failing, right? And they're failing because of man-made conditions that are bringing on and exacerbating natural disasters. When I think about Puerto Rico, I think about an island where almost every major hurricane that forms passes through, either directly or close by. And clearly we're seeing the intensity of storms, over the years. So, Clarence, just thinking about the water in Flint, Michigan, I know that that's still an issue. And I know that the community had to really push to get water lines changed from those lead lines that were being leached because of that change in the water to, lines that don't have lead. What role did your health center have in that, and the community health coalition that you were part of?
Yes, Ben. Well, we certainly wanted to test as much of the water as we could for those who needed it, and we wanted to provide bottled water to people who needed it, because you couldn't drink the water in your home, so you needed access to bottled water. Unfortunately, it meant that not only did you need the bottled water for cooking, but for bathing as well and drinking. And so it did create a bit of a problem. We did bring in some portable showers. We brought in some things to help people to at least get the basic necessities done. Work with the school system and some of the other agencies to open their gymnasium so that people could stop in, take showers, wash clothes, and things like that. Also provided filters so that people could at least put the filters on their shower heads and sinks. That helped to some extent, but even today, we still have a lot of people who are on bottled water, and it's a real problem even as we speak today. But I think that the best thing we can do is work together as a group. You know, when we found out about this thing, the health department was unaware, and that's the first line of defense. They certainly should have been aware. And then we learned that the hospitals weren't aware, and so it mushroomed so fast that you don't have time really to do very much planning. It's just thrust up on you. And when you're talking about maybe some kind of storm or that, at least you have time to plan. It's coming. But an environmental kind of emergency usually is unexpected. You have no idea, and then boom, there it is. So I think for us to work together, all pulling together all of our local partners, particularly the hospitals, the health department, and other organizations, and trying to get a handle on things quickly, working together. Once we identify the problem, then it's much easier for us as a group to work with our patient population than for one of us to try to do it all on our own.
Yeah.
So that is the main thing, having some kind of plan in place for that unexpected. The things that you would be less likely for you to think is going to happen, and you have some plan in place to deal with it. And then having your providers try to educate the patients, that's very important, so that they're comfortable talking with the providers about their issues if they have any, and just trying to come together as a community and working together to solve whatever problems that may be thrust upon us.
Right. And the water crisis was one that was hidden at first and
Yeah.
then discovered.
Yeah.
In Cancer Alley, Louisiana, you see these plants, you smell the noxious fumes, you know what they're producing to some degree. So, Gerrelda, how do you take that discussion of planning and preparation and mobilization to health centers when they can just look out over their fences in the backyard and see the threat that is clearly evident?
Sure. Thank you, Ben. And so let me tell you about two of our health centers that are actually along the corridor of Cancer Alley. And they've been doing some great work and despite what the environmental challenges are. So when Tesh Action Clinic opened its doors in 1974, and the current CEO is Dr. Gary Wiltz, in the Bayou town of Franklin, Louisiana, unfortunately, even back then, it was the first community health center in the state, and it had already faced down strong racially motivated opposition from the medical establishment and the local power structure. The clinic was created by a human relations council led by local residents Rose and Bernard Broussard that had been formed to address the racial tension. Why was there racial tension? Because the powers that be at that time thought that those people that were in the sugar plantation should keep their mouths shut and work. Nationally, the health center movement sought to empower vulnerable populations and had direct links to the civil rights movement. Locally, it drew substantial white opposition, particularly from the Franklin Foundation Hospital and the owners of large sugar plantations, many of whom sat on the hospital board. The majority of the area's residents were low-income Blacks whose sole source of income was those sugar plantations. Annually and threatened with loss of their jobs if they sought additional employment during the off-season. These individuals realized that uniting for a cause, which was health, would not only help them personally, but their community at large. So they joined together and developed the Tesh Action Clinic, despite opposition, and the clinic is still operating today because of their advocacy, and they actually have partnerships now with the Franklin Foundation Hospital. According to ProPublica, many of the new plants planted in Louisiana's petrochemical heart are being built in or near communities that EPA models estimate already have some of the most dangerous air in America. Their analysis shows the problems are especially acute in predominantly Black and poor communities, like my second example, St. Gabriel, Louisiana, where we have another community health center located. St. Gabriel Health Center utilizes its Louisiana Breast and Cervical Program grant funds to address some of these issues along the corridor. They offer free services for mammograms and PAPs, which has allowed them to be able to have early detection services and offer appropriate care. Additionally, the center offers free colorectal screening to all uninsured or non-insured patients, which is allowed for early detection again. Having a patient navigator, which they do, and a dedicated team, of course, have made a significant difference in how the center is able to engage and care for patients who would have otherwise been missed. Although health centers are in a dilemma trying to handle disease at the same time face environmental issues in the communities where they are located, they are aggressively working with patients to be actively engaged in their health care directly and indirectly via advocating for environmental standards and elimination of environmental racism in their communities. So you see a lot of the patients are actively talking about and identifying these issues and asking and putting the onus on our public health officials to address the issues that they are identifying.
That's excellent. That patient engagement and empowerment is powerful. And, just what role, Gerrelda, do you see health center boards playing in raising awareness of problems in advocacy?
Sure. So I spoke to one of my health center CEOs, and he identified two things. So health center boards, we all know, are just as important to this cause in raising awareness and advocating for change. Considering the fact that most our boards are made up of community members and active users of the health centers. Board members are the voice of the community, so they are most appropriate to partner with health centers to advocate for change. And two of the things that were identified: find objective partners who will collaborate on advocating for environmental changes and the eradication of environmental racism. So our board members can be out there in the communities because they are the heart of the community and the voice of the community, and finding objective partners that our health centers can partner with. And then secondly, find independent industry people who will look at the facts and agree on the standards that need to be implemented that will enforce the change in health outcomes in our communities. And so it means that our board members can be proactive in finding and using their connections to find those industry people, because, we know that not everyone in those industries want to see the environmental racism that has happened in the community, and talk with them and get them to understand that we need to make changes, that we need to have standards. And I guess I'll close with, we need health center boards to be at the table, as we know, because they are definitely on the menu in organizations. And in the end, it is my hope that we follow what Mahatma Gandhi said and be the change that we wish to see in the world. And this, I think, will add in our communities also the change that is necessary.
Thanks, Gerrelda. And speaking of partners to bring with you, Chauncia Willis with the Institute for Diversity, Inclusion, and Emergency Management is one of those partner organizations that works with communities of color to bring about resources and support prior to and during disasters. You know, Chauncia, I was reading recently that a study found that, you know, communities of color fare far worse from FEMA support and the ability to recover from disasters than other communities. What resources are available to support health centers prior to, during, and after environmental emergencies?
Well, that's a great question, and thank you for asking. I've been listening today, and I'm hearing all kinds of great resources that are, going to be really instrumental in providing assistance to community health centers. And one of the things that I think is going to be critical is prioritizing not only equity, but also prioritizing resilience. I've been an emergency manager for about 22 years. And one thing that we don't do well in emergency management is partner with our public health organizations in a way that allows us to actually begin to utilize a foundational structure that's there already. You already have community health centers operating in these different communities. Oftentimes, I've never been invited to speak or to train. So I train and teach and do exercises and do all these great things to prepare people for disasters, but we've never partnered with public health to do that in these communities, specifically those that are most vulnerable. And as we just spoke about, we know that inequitable systems cause certain communities to be more at risk to disaster than others. And, understanding that risk is a function of exposure to hazards. It's a function of sensitivity to those hazards and the ability to adapt. So when you add in systemic racism and anti-poverty bias, it makes many communities more vulnerable to experiencing repetitive disaster. So, our organization likes to call a thing a thing. So systemic racism and classism have resulted in increased exposure and sensitivity to hazards and a reduced capacity to adapt amongst people of color, immigrants, refugees, lower income residents, our frontline communities. And so, that's why it's so important to focus on inclusive resilience, where everyone is participating in their own resilience posture. And it's equally as important to focus on equity. And so, Martin Luther King, Dr. King said, equity requires that we grapple with underlying causes. We can't just create new programs and come up with new strategies and not deal with the systems that are already there, that are operating, that are in place, that are really being supported by those policies and programs that are creating inequitable outcomes. So, I really believe that we have to begin to work together more in emergency management and public health, bring our best assets to the table, but also begin to really uncover and unpack the existing inequities that are producing inequitable outcomes, especially before, during, and after disasters. Because as we've been saying, these inequitable systems have disproportionate impact on those who are most vulnerable.
Thank you, Chauncia. And thank you so much for all of you today, our expert panelists. It's been an incredible discussion. We could have gone for many more minutes. As you know, NAC is celebrating its 50th anniversary this year. And these monthly fireside chats offer an opportunity for us to highlight the impact community health centers are making every day across the United States, especially in this time when we are still fighting COVID-19. And I saw in our conversation how, COVID-19 and the impacts of COVID and environmental injustice really parallel and in many instances intersect. So NAC is really honored to represent the voices of the 30 million health center patients, the 14,000 nonprofit community health center sites, the 253,000 staff, and the 1,200 community and consumer board members. You can always visit our website and click on the 50th anniversary screen on our scrolling homepage to hear the past webinars we've done this year, and we've got more to come. So thank you for attending, and please visit us next month on August 31st at 2 o'clock Eastern, when our topic will be Back to School, COVID-19, and the